So before we understand what OCD is, it is important to understand what obsessions are and what compulsions are. So what are obsessions and what are compulsions? Let's look at those. Obsessions are repeated thoughts, urges, or mental images that are intrusive, unwanted, and make most people anxious. Some of the common ones include fear of germs or contamination, fear of forgetting, losing or misplacing something, fear of losing control over one's behavior, and some of the compulsions. Before we go into the compulsions, let's understand what compulsions are. So compulsions are repetitive behaviors or mental acts that a person feels almost driven to perform in response to an obsession. The behaviors typically prevent or reduce a person's distress related to an obsession temporarily, and then they are more likely to keep doing that in the future. So as the term is OCD, it is also important to understand the meaning of the word disorder. For this, you can watch my previous video titled as "Do you actually have OCD?" So let's look at the types of OCDs. There can be various forms of obsessions that may include aggressive obsessions like fear of might harming someone or fear that they may harm themselves. Contamination obsessions can include concerns or disgust with bodily waste or secretions. And examples could be of urine or feces or saliva, or concern with dirt or contamination, excessive concern with environmental contamination like asbestos or radiation toxic waste, or excessive concern with household items like cleaners, solvents. Sexual obsessions can be also, some of the obsessions can be present with people like forbidden or pervasive sexual thoughts or images or impulsives. And then somatic obsessions are another subtype where they may have concerns with illness or disease. Then one of the most common ones that we come across are the cleaning or washing compulsions, where there may be excessively or ritualized hand washing or excessive bathing or showering. Similarly, checking compulsions could include that they are checking that nothing terrible will happen or did happen, or checking that they did not make a mistake, checking that is tied to certain somatic obsessions. And then there can be some repeating rituals like rereading or rewriting, or needing to repeat routine activities like jogging or going in and out of the door or on the chair. The other ones commonly could be counting compulsions of disorder, of arranging, compulsions of hoarding or collecting, compulsions of religious kind, and some of the other obsessions that are a mixture of those that we class them as miscellaneous ones. So there are a number of obsessions and compulsions that can be present, that people have, and when we start thinking of these being more than the normal, that is where we say deviance from the normal behavior. And if they are leading to distress, that is another criteria. Then the other things that we look is how much time they are occupying themselves with this, how dysfunctional they may be. So all of these together compile a syndrome that we call as OCD. And if you do like the contents of this video, please make sure that you come back and connect with the channel, or look at the previous videos that we have done. Do like, share, comment, engage with me for further videos. See you up until next time.